understanding of what is it that we want to learn together. So let's begin with a very simple definition of what is a clinical trial. So a clinical trial is a type of research, right? So that means that clinical trials are not the only way to do research. That's very important to mention. It's just a way to do research. And it is the specific goal of clinical trials are two main things, either to test how helpful is an intervention, or test how helpful is a test or a diagnostic procedure or whatever. So those are the main ideas of why using a clinical trial. So in other words, I like to explain this as a clinical trial is the human experiment, right? It's the equivalent of experimenting with humans. So for example, in the figure here, you see the first box is the study population. So you kind of define which group of people do you want to either investigate about a test or investigate of a specific treatment, and then you divide the people, right? Or you randomly select people and put them in 2 different groups or 3 different groups, whatever. And the whole idea is that you implement your test or you implement your treatment at the baseline, and then at the end of a certain amount of time, you measure again and see if there is a difference between the 2 groups. And if there is a difference, then you could attribute that difference to your test or to your treatment. So not every clinical trial has that thing of random in there. Randomized controlled trials are kind of the most strong designs or experiments we have in clinical trials, because by assigning randomly people to 2 groups, then we kind of assume that the differences that are the random differences among the people who could potentially produce a change over time are equilibrated in both groups. So if you observe a change over time between the groups, then you can more strongly link that change to the intervention or the test, rather than just random variability among the people. So that's kind of how I see the clinical trial. So Steve and myself, we're going to talk about this, and Steve, please feel free to jump in if you want to complement anything that I said right now. Are you okay, or should I move forward? Yeah, okay. So that's good. So the next one is, so what is important to know about clinical trials, right? So there are 3 main things that we need to know about in every clinical trial. So one is, what is the clinical trial testing, right? For example, it could be, as I told you, could be a treatment, could be a diagnostic tool, etc., right? Mostly there are interventions or treatments and diagnostic tools. The second main important thing is, what is the outcome, right? So what is the, I don't know what happened with the presentation, but what is the outcome, which is, but it's important, like you are testing an intervention, for example, to know if that intervention actually changes something. What does that intervention is going to change? That's what we call the outcome. And then we have the timeline, right? So it's important to know, okay, so in what amount of time, right, are you testing the change? For example, if the outcome is pain, right? So you measure pain at the beginning, right, in the 2 groups, you do your intervention, and then you measure pain at the end. It's not the same to measure pain within, let's say, 6 months, right, than measure pain within 2 years. Very different answers, right? Because the first one is going to tell you how effective or not the intervention is for pain at 6 months. And the second one is going to tell you how effective it is at 2 years. Very different consequences, very different interpretations in there. Does that make sense? Yes, Steve? You want to say something, Steve, or? No, no, okay. So now let's look briefly about how is the clinical trial kind of concept in the world of spinal cord injury. All right. So we went to this webpage here, which is clinicaltrials.gov. You can access it, and that's one of the main registries of clinical trials in the world. It's based on the United States, and it's one of the main sources. So we did a small search just to look at how many active clinical trials, and by active I mean that right now are currently recruiting people or are in the way to complete the trial. And I just focus the search for interventions. So anything about diagnosis, procedures, trials for other types of things that are outside interventions were excluded. And this is what we found. We found that there are approximately 348 trials testing interventions in spinal cord injury in the world, and 6% of those trials are being conducted in Canada. So it's only 21. Well, not only 21%. So sorry, 21 trials, 6%. It's not bad, right? Canada, it's a fairly large country in extension, but small country in population. So that's good. So the next one, please. So then dissecting these clinical trials about remember the one of the two of the three elements that I described before, what is their testing? So in this case, which types of interventions? You can see that these trials here, and these are based on the trials in Canada. Sorry, so I left the rest of the world, and I'm just focusing here in Canada. So you can see that out of the 21, 6 are testing drugs. That's the intervention that they're doing, right? The majority is drugs. In second place is more the psychological behavioral outcomes in spinal cord injury. So interventions that help people to improve their mental health. And then on the third, sorry, no, that was the third place. The second place is the physical agents. So by physical agents, I mean the use of electricity, radiation, and light. So basically, that's what you have, your functional electrical stimulation, your epidural stimulation. So the use of these agents as interventions to do something for the population of spinal cord injury, that's the number 2. And the number 3 is the mental health. And the rest, as you see, it's just one trial. So you have interventions related to respiratory, like breathing, exercise, dressing wounds, right, and surgery. The next one, please, Taryn. Now, the second aspect is which outcomes are they measuring? Remember, we said that the outcomes are important, right? Because otherwise, the answer is going to be based on the outcomes. And as you can see, number 1 is neurological recovery. So a lot of these drugs and a lot of these physical agents are focusing on the recovery of the neurological function. Number 2, with 4 trials, we have self-management, adjustment, and mental health interventions. Sorry, mental health outcomes. So how do you feel and how do you manage your illness? And the third one, which has 2 trials, is the pain. So 2 trials are specific about pain management. And again, the rest of the outcomes, balance, fatigue, bowel function, blood lipids, falls prevention, are just 1 trial per each. So this is just a way to explore the lay of the land in a brief way, right? Of how, like, what is going on in terms of clinical trials for interventions in Canada, right? So I want to take a moment, a pause for 30 seconds, and ask you to complete a poll that relates to this information that I just presented. So one question is, do you have what? No, this is not the one, Joanna. There was a third one. I don't know if we had it available. If not, we can move ahead. That was the third one, yeah. Exactly. So do you think these clinical trials reflect your priorities as an individual, either living with spinal cord injury or someone helping with people living with spinal cord injury? We want to know. And once you're done with this, we're going to go to Steve.
All right. Thank you, Beto. Very informative. Just a quick introduction on myself. My name's Steve. I work at Spinal Cord Injury, Alberta. I have a T6 spinal cord injury, and recently I took part in a clinical trial, the ESTAN clinical trial, as you can see here. The stimulator that they implanted was very similar to the one that you can see on the screen. Basically, what it is there's a battery pack on my lower hip, like my lower back on the right side of my body. And then that paddle that you see in the little blue part of the screen there is, there's a whole bunch of different channels on that, and that stimulates different nerves in my body. And the idea or the primary outcome that they're looking for would be to get some volitional movement, changes any movement below my injury level. Some of the other things that they looked at, of course, you can see here, they wanted to, or they noticed once they put these stimulators in, was some changes with blood pressure control, bowel function, and cognition. Some of the other things that I've noticed since I've had it, one of the major things that you can see at the bottom here that I've noticed is spasticity. That's one of the biggest changes that I've seen, something that bothered me, that affected my life day to day. And since I've had the stimulator put in, that's changed drastically. Another pretty major thing was my body temperature control. So at the start, as a lot of you might know, that when you get cold and it's just really hard to warm up, whether you're inside or outside, whether you're outside and it's warm out and you're really hot, it's hard to cool down. I've noticed a big difference with the stimulator since I've had the stimulator with that. About the stimulator, again, I'm going to just talk a little bit about how I control it. So the stimulator is controlled by, I have an iPod that has an app that's downloaded, and I control my settings. So I can change settings, and I get a list of settings that I have to use every single day. And they change from day to day. And those settings are then, I have to take a survey on each setting. So it goes from, say I have program 8 one day and program 9 the next day. I then have to compare both programs, and they'll affect, like there'll be differences in each program. There's different amplitudes and whatnot that, and they're stimulating different areas as well. So that's a little bit about it. I'm not going to talk too much about the stimulator right now, but we can always go back to that after. So I'll talk a little bit about the experience. It started off, I was listening to Dr. Phillips out of Calgary give a presentation on the East End, and they were part of it. And it was at an FBS conference here in Edmonton at the U of A. And after the conference, anybody that was part of the conference went out for dinner after, and I sat down with him and I started to ask him a couple questions about it. And although he couldn't tell me too much about what was going on because it was a clinical trial, he did kind of urge me on. I had the right criteria. My injury level was perfect. My health, I had good health. I was eager, interested, and those are all kind of things that he liked. So he kind of just pushed me in a way to apply. It took actually a couple months before I ended up applying to it. I thought about it for quite a while before. Just thought about, what it could do, what could change in my life, the good and the bad aspects of it. But eventually I decided that it might be a good idea, and I applied for it. It took quite a while to get in. There was a wait period They sent me a questionnaire that was about 50 questions long. And that was part of the process. And then it was to fly down and get in-person assessment. So they wanted to check not just my medical records, my MRIs, but they wanted to meet me in person and see, you know, more than just my health, but what type of person I was. And the day after my birthday, actually, I got accepted to the trial. They sent me an email, and it was almost scary, but at the same time exciting. This is obviously something that I wanted to do. And of course, when they asked me or accepted me in the trial, I was very eager. I was ready to go. They made a date for me to come down for surgery. I'd have to go down. It takes place in Minneapolis. So the idea is for my in-person hearing, I had to fly down, meet with them, fly back that next day. And then when surgery came, I had to be down there for 4 to 5 days. So after surgery, so I went in for surgery, got to surgery. As I woke up from surgery, because you had to be put under for this, I woke up and the doctors were standing there and they turned the stimulator on right away. And the first thing that they tried to do was ask me to move my legs. And with the stimulator on, I was able to move my legs, just laying there in bed, still trying to recover, still trying to wake up from surgery. And at that point, I really didn't understand what was going on, but I knew that it was exciting and that everything worked and that I was, first of all, healthy and the surgery went okay and the stimulator was working. So part of the reason they do that was because when they put the stimulator on your, the dura part of your spinal cord, not on your spinal cord, just over top of it, they want to make sure they have it in the right place. So sometimes it could be a little bit too far to the right or a little bit too far to the left, and it's going to move. You won't get as much movement out of one side than the other, or if they put it too high, right? So they have to find that perfect spot. So I guess during surgery, when I was under, they're testing the stimulator to make sure that it responds properly and is put in the right spot. And then after, obviously, when I'm awake, they want to make sure that I can not control it, but I'm aware of what's going on, I guess. So that was the surgery part. And then now it's been over a year since I've had it. And I've gone down 6 different times, once a month following the surgery. And every month I go down and they adjust the settings based on the answers to my surveys that I had been doing. So what they're trying to do is pinpoint exactly the best parameters that are going to give me the best results at the end of the day. So that's the point of going down for the year. So it's a year-long trial. I've gone down 6 times. Obviously, since COVID hit, I haven't been able to go down. The last time I've gone down actually is February. So it's been quite a while. They have opened up the doors to the hospital and I'm allowed to go back now, but I don't feel safe quite yet flying, especially, into the United States. But more about just what it's been like. I mean, since the surgery, it's definitely beneficial. I found it beneficial for myself, just my day-to-day life. The little things like I talked about earlier with the spasticity, the body temperature control, no lightheadedness when I'm waking up in the morning, getting out of bed, little things like that most people wouldn't even realize people with spinal cords deal with, but we do deal with them every day. And then to go from dealing with that every day to not dealing with it was, those small changes were just enough to make that worthwhile, put it that way. The part with like a volitional movement, so it had gotten better as within those first 6 months. I noticed that it was getting stronger and better, more controlled movements. The movements, when I talk about movements, are dorsiflex, a little bit of hip extension, a little bit of kicking motion, right? But nothing, I haven't been able to do any more than that. So it's not like I'm able to stand or walk, take steps, no walkers, nothing like that yet. It might be a possibility one day, I don't know, but I just take it as it comes. I had no expectations going in. I'm not trying to raise the bar very high, but I just wanted to see what this is, like what it can do for me going forward, and just slowly, noticing those small changes. And as it got better, obviously it's going to help with, you're going to feel, you're pretty good about what those situations are, right? So yeah. Tim, can we just see the next slide, please? Thank you. It looks like we're having troubles hearing. Can everybody hear me, or is it just one person right now? Sorry.
Still.
Is it good?
Oh yes, it is resolved. I can hear now.
Perfect.
Oh yeah. Okay.
Sorry, guys.
Good.
All right. So some of the considerations. And this will kind of, me and Beto can kind of talk a little bit about this and share just some of the things that I've experienced, and then Beto can kind of give his input in on it, and on a professional level. Mm-hmm. So one of the main things that I was told when I was injured 10 years ago was, one of the doctors said to just stay in shape, keep your body healthy. You never know what can happen. Science, if you ever want to take part of a trial or anything along those lines, make sure that you're healthy with your body and mentally healthy, right? Take care of yourself. So I took that very seriously when I was injured, and when I got to the hospital, and I did little things like to try and keep my body healthy, as far as eating right, exercise. I got a standing frame. I used FES quite often, and I felt like these things would be beneficial. What I didn't realize was that doing those things would help me mentally as well. So the better I felt, the better my body felt, the better I felt about myself, emotionally, mentally, I felt better as well. So to take part in a clinical trial, and specifically this one, part of it was your health, and they did bone density scans and things like that to make sure that my body could handle what the stimulator was going to do, right? So maybe Beto, you could talk a little bit about the importance of staying healthy and keeping your body healthy.
Yeah, and thank you, Steve. I think that's one of the points that I want to make. I want to make a point here about clinical trials, right? Because you're right. It's good. I'm not saying that it's a bad idea to be healthy. I think that's the goal for everyone. But what I want to take the point and that clinical trials typically involve people with very specific characteristics, right? So in other words, they're very picky. And why is that? Because they want to compare people, or to assure that they control everything in the trial, because this is an experiment. So the only variation is the intervention, right? And that makes clinical trials a little bit artificial at some point, because at the end of the day, you will get your results, right, from a population that was very selected. And then why? And then what? Are you going to be able to extrapolate those results to the rest of the population? Are you going to be able to expect those results in the rest of the population? And that is one of the main issues that we have with clinical trials. Adding that is, for example, the trial you are, this one, Steve, it doesn't include a control group, right? Which is good, that at least everyone is getting the intervention, right? But that being said, that comes out with some challenges in trying to interpret the effects of the epidural stimulation in this case, and correlate those effects to the actual outcomes. For example, remember what we talk about the outcomes, right? Very important to always know about the outcomes. And in this case, the primary outcome is motor function, right? Recovery of motor function. While you're expressing, right, that you have other outcomes as well that you put it as secondary, because secondary are the ones that, yes, the investigators already kind of say, okay, our main outcome is motor function, but maybe secondarily we're going to look to this and this and that. But then the last part that you put in your slides, Steve, is very important, because that is kind of like the outcomes that you're perceiving that are even outside of what the investigators expected. And you just hit the nail, and I wanted to bring it back to you, because for me, this says a lot. This tells a lot about the priorities between what are the priorities for the researchers and versus what are the priorities for the people with lived experience, right? And in this case, I think they are aligned, but there are some nuances in there in which, yes, you're saying those small things that maybe for someone else are not important. And maybe those are the things that we should be focused as well. So what do you think about that?
Yeah, absolutely. I mean, the end goal, I feel like in all of these trials and the epidural ones or the stem cells trials, things like that, the end goal is always for movement, to walk again, right? Mm-hmm. And obviously we have to go through these trials, these steps, in order to figure out what works and how to get there. But at the end of the day, at this point in our life, in my life anyways, and I can only speak for myself, but it's not always about just being able to get up and walk, and being able to take a clinical trial like this and to see that their goal is for movement and to walk, but to see all the other things that I benefited from it along the way, is what really made the difference between me being able to sit on the edge of a bed and kick my leg, as opposed to something every day that I use every day, like the spasticity, where I transfer from my car to my chair and not having to deal with it, or laying down in bed and not having to deal with it. Those are things that happen every single day that I use, and that is more important than being able to kick my leg a little bit, right?
Yeah.
But I also see the importance of having that end goal for the trial of walking, and when we get to that point where we're able to kick, or they could see that, you know, at the start I couldn't, and then halfway through the trial I'm kicking and moving, for them that's a huge step, and that's what they're really focused on. Exactly.
And that's a point, Steve, for me. That's what they're focused on, and that's great. However, again, it goes everything goes to priorities, right? And why am I putting so much emphasis on this idea of the primary outcome versus the secondary outcomes, or even the non-expected outcomes? Is because each trial is designed, the experiment is planned around the idea of the outcome that you want to, that is important to you. In this case, the motor function for the researchers, which is great. I'm not suggesting that is not a relevant outcome. It makes sense to me as a clinician. But what I'm trying to put here on the discussion is that how can we integrate the priorities from people living with a spinal cord injury better in our designs, meaning that they become primary outcomes, right? So that's my point. Now, I want to ask you something, Steve, because this is very important. And I really want to know, it's about about the reasons. You talk about deliberations. You thought a lot about making the call, right, to enroll. For me, I really want to know, in your perspective, what was going on your head? How much was this based on the benefit that you could get specifically to your body by participating in these experimental treatments, versus also doing this for the rest of people who are living with a spinal cord injury in the world, right? So what is that?
Yeah, it's a good question. And I mean, I did kind of go back and forth. Obviously, you hear about the outcomes, and it makes you excited. You want to take part of it based on for yourself. But at the same time, I felt like when I went in and they did an assessment on me, and they looked at all my medical charts, and they thought that I was a good candidate, it made me think that the reason you say yes when they asked was, if I'm a good candidate, and if the the doctors believe that this stimulator will work good on me. It's going to make them look good. It's going to help them push this forward and get approval from the FDA so that we can get more people involved. And I felt like at that point that it was almost like I was lucky enough to get accepted, but also that my body was in good shape, like we talked about earlier, and I was healthy enough that it would be a good candidate, and I would help the community moving forward. So I really wanted it to be something where I was not used as an experiment, but kind of in that way, you're used as an experiment.
Yep.
But that I know deep down that at the end of the day, that this is what's going to help for the next generation of spinal cord injuries, where, you know, maybe somebody doesn't have to go through what I went through. Maybe this is something where it can help find a cure at one point, who knows, right?
Mm-hmm. Mm-hmm.
But yeah, absolutely. Like, I think the most important thing was, and doing it for my community and knowing where I was in my life, where, you know, I was happy. I wasn't doing it to change the outcome of my injury, or I wasn't doing it to change to make myself feel better, or, you know, I was comfortable with my life and where I was being in a wheelchair and living in a wheelchair.
Mm-hmm.
So I feel like that helped quite a bit when I didn't raise my expectations as much when I wasn't able to get up and walk around after surgery, right?
So that's an important point. So the mental state, right? When you are, the understanding of what are the expectations and the mental state, the station on life, right? At that moment, it's important, right? That's what you.
Yeah, absolutely.
Okay.
And I'm just going to kind of move on here now. Just some of the other slide, or the other note there, it says some of the costs and considerations. Yeah. And when we talk about that, I talk a little bit about obviously the time is a cost, right? So your time that's involved in this. So if you think about, like, when you're introduced into a clinical trial, not all of them will be the same. The one that I'm speaking about is the one I'm in right now. And I mean, you have to fly down to Minneapolis once a month. So there's the cost of those missing 2 days work, or trying to miss, or maybe just the 1 day. There's also the money involved in the tickets, plane tickets, food, hotels, over and over for a year is quite a bit. It adds up pretty quick. Mm-hmm. And then there's also your time at home. So when I'm every day doing these exercises that I have to do every morning, and then the surveys, and also, you know, talking with them throughout the month, right? You know, you're emailing back and forth with the doctors and whatnot. And it's pretty, there's a lot, you have to invest quite a bit into it. And you know, if you really think about it and you want to get involved, you have to think of that aspect with money and your time. And it's a big commitment.
That's a good point. And that's something that, again, I'm learning here. Like, as a researcher, right? You plan your design, you get your outcome, you plan, you have the knowledge to do your plan, to get the appropriate data, to do your analysis, and then to reach us to a conclusion. So at some point, we kind of dehumanize the participants, right? Because at the end of the day, it's an experiment. We call them actually subjects of the participation, which is kind of awful, right? And this is about the clinical trials. Remember, there are other ways of doing research, but that are also complementary. But today we're talking about clinical trials. So it is important for researchers to know this and say, okay, these subjects have a life of their own. They will have, they will need money to participate, and or even if you cover every expense, they will stop doing something to participate. So that's an important thing. Why I feel it's so important to get people involved more in the design of this research. So research could be even more meaningful and less impactful in a negative way for people with the spinal cord injury.
So if there was some sort of committee out there that can help people living in wheelchairs, to help guide some of the researchers in the right direction, right?
Mm-hmm. Exactly. That idea that is fantastic.
Yep. All right.
Steve, do you think we should move to the open discussion? We have an initial
Question.
right, Taryn? Okay.
Yeah.
Yeah, so there's an initial question here that just says, did you receive any funding for your travel or accommodation, Steve?
Yeah, no. So I did a GoFundMe to raise a little bit of money to help with that. And other than that, as far as any government grants or fundings from anywhere else, I didn't get any. Now, one thing about the clinical trial, and I don't think I said it, I didn't speak on this before, but so being part of the clinical trial, I was, the surgery and the device was covered by the trial. So I didn't have to raise any money for that or pay for any of that. It's just for my flights down and hotels.
Yeah, which is still is considerable because it's in another country. That's another aspect that we can open to discussion. Like, are we in Canada doing the type of research that you really think it's relevant to you? I think it goes to that idea. Right?
Yeah, I mean, the fact that I had to reach out and go to another country to, take part in this clinical trial. I mean, at the time, I didn't think too much of it. I just wanted to take part in it. But once you start booking flights and, you're 3-4 months in and you start to realize how much, what the cost is, of course, money wise, but also time wise. And there was one time I went down, I flew down in the morning and I did my assessments and got my new settings and whatnot, and then flew back that night. So you do that on a Friday, that whole weekend, you have no energy. You're tired. That's a long day, right? So, but yeah, go ahead.
So sorry, I think there is a follow-up question from Casey. So maybe like Casey, you can open up. So that now we're going to change a little bit this flavor. You can ask your question yourself or make comments. This is not about questions, guys. This is about opening up for conversation. Okay, so Casey.
Yeah, hi, Steve. Sorry, I may have missed it initially, but I was just wondering how you found out about that study or how you came across it.
Yeah, hi, Casey. I was at an FES conference at the U of A back in 2017, I believe it was. And Dr. Phillips, who is part of the study, they do the cardiovascular aspect of it. So they do a lot of studying on how it affects your cardiovascular. And he had given a presentation on it. And after the presentation, obviously it sounded interesting right away, but I sat down with him after during dinner, and he kind of gave me a rundown of more than just the cardiovascular aspect of it, but started talking more about like what some of the outcomes that they had. I think at that point there was only 8 other people in North America that had it. So there was 2 other people in Canada that had gotten it done. And you have to, like, a lot of these people, like everybody, it affects everybody completely differently. So I know there was one of the participants from Canada, actually, she was able to actually go to the bathroom on her own without a catheter or anything like that anymore. So that was a major step. So when you hear things like that, kind of, you know what I mean? You get excited. You think that this is possible for you. You think maybe, who knows, right? But it's not always the case because every injury is different. So it affects everybody different as well.
And to complement that, Steve, that question, Casey, is fantastic because where did you find out? So you went to a conference. So not everybody is engaged in this type of thing. So again, the importance of building up a community in which we're more connected. And by we, I mean people with spinal cord injury, researchers, clinicians, so we can have more efficient communication and spaces like this in which we can promote and we can work together towards doing meaningful research.
Yeah, I totally agree. I think, and then the other thing too is that clinicaltrials.gov website that Beto was talking about earlier. I knew about that shortly after my injury. So I was always looking on there. I think when you're first injured, you've always spent a lot of time on the computer. I don't know if you guys can agree with me, but you're doing a lot of research, right, Ricardo? Yeah, you're doing a lot of research. You're looking around. You're trying to find out what, you know.
A ton.
Right? And I stumbled across a couple different websites. One of them was the Spinal Cord Injury Zone, and they would post other things that they found, like other research opportunities that were going on, or anything that they were doing with spinal cord, whether it was stem cells or epidural stimulators, whatever it was. So I was following that, and then through that I found out about the clinicaltrials.gov, and then I was on there all the time, just trying to find anything that was out there, right? And we look for things in Canada, but unfortunately, like Beto was saying earlier, there's not a ton going on in Canada, right? So eventually you just kind of expand your search to the rest of the world, or North America.
And Steve, I think one of the things that you shared with me was that there was like so many applicants, and it was a really long process for you to be one of the select few that was chosen to actually participate.
Yeah, that's a good point, Karen, actually. So because they open it up to the whole world, so when they open up this clinical trial, East End reached out to everybody. So it didn't matter where you're from, they got applicants from all over the world. And you'll see, and I think Beto touched on this earlier, is just the fact that when you apply for a clinical trial, there's a certain criteria that you have to fit. And it starts, just your injury level has to be between, like this criteria anyways, or this trial had to be between a certain level. And if you weren't in that certain level, then right away you weren't able to participate, right? So I think that's a big part of it. Was a lot of people, they're reaching out, they're trying to find out, and then some people even that I know that I'd reached out to them and even though they were, they fit all the criteria, sometimes they still don't, accept you into the trial.
And again, I think I would love to open up the conversation to everyone, or a question is, what do you think about the priorities? What do you think about this specific point of, so trials select people according to trialists or researchers' priorities, right? How does that fit with your own priorities? What do you guys think?
Well, I personally think that by limiting it to a certain group, maybe the researchers are doing that for a reason, because they want the best outcome possible. That's my opinion.
Okay, thank you, Brandis. Yeah.
Yeah, and I believe I agree with Brandis on that one too, because for them, they're trying to get their study approved, right? Whether it's like the FDA or whatever we have here in Canada, sorry. And in order to get it approved, they have to get the best outcomes possible. So they're going to try and narrow it down to the best applicants possible, right?
Yeah. But let me just clarify that there is a strong movement now that is questioning this clinical trial purist approach, because at the end of the day, yes, you have the results, but how applicable are they to the actual population, right? Mm-hmm. So there is a strong movement in which we are using more different techniques of research that do not exclude people, right? So we can have, I'm not saying that this one is the case, Steve. I think this trial is it still has criteria, but it's not as exclusive at all as other trials, but still we can do better. And that's a good point. Yeah, a good point. Like, researchers know about research, right? So we know what are they. We went to school. We learn how to do this. However, that doesn't remove us from. That doesn't tell us that we're experts living with a condition. And I think that's a big gap, because if we don't listen to people who are actually living with the problem, right? We could be experts in how to do the experiment, but if we're not asking the right questions, and so if it's all about the question, the research design is going to be good or bad based on what question you want to answer. So that's that. I just wanted to add that. Sorry, go. Anyone else?
Yeah. Well, if I can jump in, I think that when we speak about research, you still, you still have to consider the fact that you first have to target a certain type of population within the subpopulation of injured people to have a first result. And then from that specific outcome, you can apply to different conditions, but you first have to find a stable point from where you can work. So I think from a research perspective, you need to narrow it down. I don't see that choosing participant basing on their condition as immoral, because that's what we are speaking about. So I don't think it's excluding someone is from a research perspective is immoral in that sense, because it's not public health. It's not you're not consider it from like, you know, treating someone like as it is like a medication. It's still a research. So I think there are other aspects that have to be considered morally in the research design, like what happened in that research when you have like, I don't know, like placebo. Maybe you give medications to some patient and you make them sign that maybe we are giving you something that is not the actual treatment, but we need that because we have to check what is the effect for real. So they do that. Of course, there is some reason for that to waive out some of the bias due to that, to the effect that, you know, by thinking that you're receiving a treatment. And that's for sure, it's different, and that's in the design can be considered as a moral point of view. But in choosing the participant, I'm sad. I mean, I understand the point, but it's hard to don't consider that. I mean, you have to do it if you want to do research.
Yeah, that's a very good point, Ricardo, because just quickly, let me tell you this. So now when you apply to ethics, whatever research proposal that you have to apply through an ethics board, right? So each of ethics board now, they have a specific section questioning you. Every time that you put inclusion criteria, they ask you, is this inclusion criteria, why are you excluding these people? And is that exclusion could be avoided? So you see, and so this is evolving now with the morals, Ricardo. So for example, myself as a researcher, when I faced that question, where did I get it? Where did I get my answer from? From my own mind. I say, yes, this is my justification, the scientific justification of excluding people. And again, let me go back to my point. Am I correct? Or should I need the perspective of someone living that situation so I can understand the full picture, right?
Yeah,
I'm just being the devil's advocate.
That's for sure. Yeah, that's including is always better than not, but then choosing is mandatory.
Yeah.
Thank you. I have another question. I was asked if I had any negative side effects from the stimulator, and it's a really good question, actually, and I never even thought of it because, to be honest, I haven't had any. There's nothing that I've noticed where I've looked at as anything negative. I mean, the worst case scenario, like the worst thing that I've noticed, or the most annoying thing that I've noticed is when I lay down in bed, and what happens is the pressure from the bed pushing up against the stimulator. So it makes it like it's almost turned up so that my legs will flex or tighten up, right? And that's about it. Like other than that, I mean, that's minor, I find. But I mean, other than that, like it's all really been positive. Thank you, Casey.
I know we don't have very much time left, but Steve, can I just ask you what happens after the year's up? Does it just get removed and then you're done?
Yeah, such a good question. They leave it in. So the only difference is, and I believe, and I'm not 100% sure, but they leave it in, and then I believe that they still have to take care of me, like, so that if there's any issues with it, if anything happens, and Beto, you might be able to answer this, but they would have to make sure that, you know, if it didn't work, they would take it out. If I needed a new battery, because it is battery powered, and I don't know how that works yet either. But if the battery ever dies on it, I mean, do they have to cut me open and change the battery? I'm not sure.
You will require that, Steve, and that's an important piece that we need to consider in Canada, right? Even though we're not doing this research here directly, we need to create capacity in our clinicians to deal with this, because people, you know, that in Thailand, that is not a research one, it's just a business, because they're already doing it. But if people, they have the right to do it, pay the money, go and come back, and if they come back, we need to understand programming of the device, the parameters, and provide that long-term care, because yes, an epidural stimulation will work, as it needs maintenance and it needs follow-up. It's not just like something that you can stop.
Yeah. And another thing to add to that too is what I've noticed is since February, I haven't been able to go down to change the programs to adjust the settings. I've noticed that my body, as time has gone on, has gotten used to these settings. So it's like it doesn't, my body, like I can still, you still get the same movements and whatnot, but like the other side effects. So like I've started to get a little bit more of like the spasticity is starting to feel like it's starting to come back. I might just be crazy. I might be wrong, but I feel like it is sometimes, right? So one thing that might have to be done is that they continue to adjust the settings throughout the period of the stimulator for the rest of your life or however long you have it in. And there might be a possibility. I'm not sure, but just from my experience, I feel like that could be.
That is correct, Steve. Yeah, that is correct. That happens because remember, neurostimulation is not only, we have tons of experience on neurostimulation on the brain, right? Yeah. For Parkinson's and all of that. And that's what it happens. Like it's a long life deal, right? It's not, yeah.
So I think we had a really good discussion today, and I think that there's definitely value in us having another webinar in the future about research. But we are down to our last minute, so I just want to be mindful before we get cut off. So I'm just going to share my screen again so that we can do the last poll. So maybe Joanna, if you don't mind popping up the last poll.
I think that's the correct one, right?
Is that the first one?
Yeah.
That is the one, yep.
That's fine. And if anybody has any other questions or wants to ask anything about the trial, Taryn's going to share my email at the end of this, and you guys can reach out. There we go. Perfect. Thank you. It's right there at the bottom. And I mean, feel free to reach out, ask me any questions you'd like. I've had a pretty good experience with it. I mean, there's a lot that goes into this specific trial, and I just would say don't be too worried about, you know, participating in other trials moving forward. I mean, think of it, it's a positive thing that we can do for our community, I think. And that's obviously just my opinion, right?
No. Yeah, I agree with you, Steve. I talking from the researcher side of things, I think we need to listen more and to work more, learn more from people who are actually using the research products that we design. So we make sure that they are relevant, and thanks for that. I think, yeah, it's solidarity at the end of the day, right? So it's not just about yourself; it's about the rest of the community. So. Thank you for that.
Thanks, Stephen Beto.
Thank you very much, guys. Thank you for joining.
Everyone, very nice to see you.
Okay, thanks, Taryn.
Thank you, Taryn.
No problem. Do I just leave now?